You're watching the news leader, Channel 7 Eyewitness.
Still ahead of 5, relieving hip pain. The different options patients face and which treatment is best for different situations. Next. Patients with severe hip pain may have a choice between two treatments, a total hip replacement or a newer procedure called hip resurfacing. So the question is, which is best for patients? Dr. Jay Adlersberg is here with more. Jay?
Shade, Diana, hip resurfacing started in 2006. Surgeons put a metal cap on the head of the leg bone, which preserves more normal bone than the standard total hip replacement operation. But the new method doesn't have a track record as yet, and the strict criteria for this surgery mean it's good for only 4% of people with severe hip arthritis.
Stand on your right leg.
52-year-old Jay Pelk's left hip joint is now made out of metal. You wouldn't know it to look at this lifelong athlete, but a few years ago, his arthritic left hip cut short his running and lifting weights.
I literally was starting to limp when I would try to run.
Jay learned that hip surgery was his only option. Dr. Patrick Meir recommended this device, a metal cap on the head of the leg bone and a metal socket in the pelvic bone called hip resurfacing.
He cited that I was in an excellent shape, that I was relatively young, that I wanted to continue exercising as long as I possibly can. He said my bone structure was very good.
Just the right criteria for resurfacing, but there are downsides. Patients may have allergic reactions to the metal parts. The leg bone under the metal cap may break. Some patients who have weak bones from arthritis drugs can't have it. Also,
females, ladies, are faring not as well as males because of their body size and because of their relative bone quality.
And resurfacing is limited to young athletic people. The great majority of patients, though, are better off not with a hip resurfacing procedure, but with a total hip replacement, where a metal stem is drilled down into the leg bone with a small ball joint on top. It has a great track record since the 1980s. The smaller ball, though, leads to the main downside of this joint, less mobility and possibly the ball popping out of the artificial socket. But for Laura Schultz's arthritic right hip, this tried and true hip replacement has made all the difference.
I have a new life. There isn't anything I can't do. I walk. I don't have any pain at all. None. Not at all.
The risk of a broken leg bone that we mentioned for hip resurfacing is 5% or less. Both hip replacement and resurfacing are major operations with all the risks associated with those procedures. And speaking of arthritic treatments with surgery, the Arthritis Foundation's annual walk is this Sunday, and I'll be participating. It starts at 10 a.m. in Battery Park, and we'd love to see all of you out there. Go to 7online.com for more information. Shade, Diana.
Great. Good luck with
Jay's
that, Jay.
walk, your special.
Yep, all sorts of stuff. And Jay, I hope the weather holds up for you. No.